So, let's talk about psoriasis in sensitive places. Psoriasis can occur in various areas of the body, including the genital area, armpits, and under the breasts. When this happens, it can be particularly uncomfortable and challenging to manage. Here are some tips for dealing with psoriasis in sensitive places. Keep the affected areas clean and dry to prevent irritation and infection. Use gentle, non-irritating skincare products and moisturizers to soothe the skin. Avoid tight clothing that can cause friction and worsen symptoms. Talk to your healthcare provider about appropriate treatment options for managing psoriasis in sensitive areas. Psoriasis in sensitive places can be difficult to deal with, but with the right approach, you can find relief and manage your symptoms effectively. If you have psoriasis, you may also experience nail problems, with nearly half of people with psoriasis having nail issues, which can go up to 80% in those with psoriatic arthritis. Some signs that your nails may be affected include pitting, thickening, discoloration, or separation from the nail bed. To manage mild nail changes, you can try scraping, filing, or polishing your nails and keeping them short to disguise the appearance. It's also important to avoid injuring your nails, as this can worsen the condition. For more serious problems, your doctor may recommend corticosteroid injections in your nail bed or treatment for a fungal infection in your nails, which is common in people with psoriasis. In severe cases of psoriasis or psoriatic arthritis, your doctor may prescribe medication that affects your whole body, which can also help improve nail problems. If you suspect a fungal infection in your nails, it's important to consult your doctor or dermatologist for proper treatment. Psoriasis in sensitive places, like the scalp, can be a challenging condition to deal with. It can cause mild scaling and flaking, similar to dandruff, but it can also become severe, resulting in thick, crusted patches that cover parts or all of the scalp, and can even extend onto the neck, ears, and forehead. If you have mild scalp psoriasis, your dermatologist may recommend shampoos or topical solutions with tar or salicylic acid to lower the number of skin cells your body makes and ease itching. They may also suggest steroid scalp injections or antihistamines to manage the symptoms. For more severe cases, prescription scalp ointments, liquids, creams, foams, or shampoos may be prescribed, some of which contain corticosteroids. In cases where psoriasis affects other areas of the body, a medication that deals with all the symptoms, such as biologic drugs, may be recommended. These drugs target specific parts of the immune system to provide relief. If you notice your psoriasis flaring up in sensitive places, it's important to let your doctor know right away. This can lead to cracking, blistering, and swelling, which can be painful and increase your risk of infection. Your first step is usually to apply medicine directly to the affected areas. Your doctor may recommend using tar products, salicylic acid, or corticosteroid creams or ointments. You may have more success by using more than one of these at a time. Additionally, you can try using roflumilast, Zoriv, or tapinarof, Vtama, cream once daily, which is safe for all areas of the body. It's important to try different moisturizing creams or ointments to find one that doesn't cause stinging. Your doctor may also suggest using calcipotriene, a form of vitamin D. After applying it, you can wear cotton gloves or socks to allow it to soak in without getting on other areas. If you have deep cracks in your skin, speak to your doctor about using superglue to seal them. While this may sound unusual, some dermatologists recommend it to prevent the cracks from worsening. If these options don't work, your doctor may prescribe medication such as methotrexate, which suppresses the immune system. They may also recommend light therapy, also known as PUVA or UVB phototherapy, but only do this with your doctor's guidance. Psoriasis in sensitive areas is not common, but it can occur. The patches are usually white or gray and can cause discomfort, making it difficult to talk and chew. If you're experiencing this, it's important to speak with your doctor. They may recommend a low-potency steroid cream, such as 1% hydrocortisone ointment, or a steroid-free treatment like pimecrolimus or tacrolimus to help suppress your immune system. Psoriasis can appear in sensitive places, like your genitals. Some people may only have psoriasis in this area, and the flares can be pink or red, with little or no flaking or scaling. Psoriasis in sensitive places can also cause painful cracks, especially between the buttocks. When treating psoriasis in these areas, it can be tricky. Regular moisturizing can help, and it's important to ask your doctor about the best moisturizer for you. Topical vitamin D creams and ointments, as well as roflumilast, Zoriv, and tapinarof, Vtama, creams, are options for treatment. You may be prescribed low-dose steroid creams or Eucrisa ointment for a short period of time, because the skin in this area is thin and using steroid cream can make it even thinner. Avoid using coal tar products or light therapy in this area, as they can irritate the skin and increase the risk of skin cancer. Wearing loose-fitting cotton clothing, including underwear, especially while sleeping, can help reduce friction and make things more comfortable. Sensitive areas such as the armpits, groin, and genitals can be affected by plaque psoriasis. This can cause red patches of skin covered with silvery scales. The same condition is also common on the knees, lower back, and scalp. To manage this condition, it is important to apply moisturizer daily and consult with a doctor. They may prescribe a mild corticosteroid ointment as a first step. If this does not work, stronger medications such as triamcinolone, acetonide, Trionex, or clobetasol, Timovate, may be recommended. Synthetic forms of vitamin D called vitamin D analogs, as well as medications like roflumilast, Zoriv, or tapinarof, Vtama, cream, or steroids combined with tazarotene, Tazorac, can also be used. In some cases, steroid shots inside the plaques or light treatment may be necessary. For more severe cases, biologic drugs that target specific parts of the immune system could be prescribed. It may take some trial and error to find the best treatment for you, so it's important to work closely with your doctor and be patient. Areas where the skin bends, such as the armpits and groin, are common areas for psoriasis plaques. When the skin in these areas rubs together, it can cause irritation. It's important to wear loose-fitting clothing and keep these areas moisturized. Additionally, be cautious in the sunlight as sunburn can worsen the condition.